clinic based in Jogeshwari, East Mumbai by the name of Arogyam Clinic. So today I'm going to talk about lactose intolerance allergy. Okay, so is lactose intolerance in kids the same as milk allergy? No, these two are entirely different terms. These two are different terminologies, and maybe their symptoms may be similar, but their treatment is different, and their meaning is also different. So we're going to look into these two topics are the same. So if a parent sees any unusual reaction in their baby after consuming milk or milk products, they should know is milk allergy or whether it is lactose intolerance. So you need to find out that. Then the workup can be done. Now, what is milk allergy? When we are talking about milk allergy, we are basically predominantly talking about cow's milk allergy, because that is the most majority of people consume them, that cow's milk. But also we should keep in mind, like sheep, goat or other mammals milk can also cause allergic reactions. So what is milk allergy? It is an immune response in our body, and why that immune response occurs, that is due to the allergy because of the protein that is present in the milk. तो मिल्क में प्रोटीन जो होता है, दैट इज वी से casein or whey protein. So basically we are allergic to those proteins that is present in milk or milk products, and that is termed as milk allergy. Now what is lactose intolerance? So lactose intolerance is a digestive problem. Okay, why this digestive problem occurs? Because our body is deficient, or it has a decreased lactase enzyme. This is a digestive enzyme, lactase enzyme. Now, what is lactose and what is lactase enzyme? We will discuss about this. So, what is lactose? Lactose is present in milk and milk products, and also other products like curd, yogurt, cheese, and other dairy products, buttermilk. Also, it's present in bread and some packaged food items, some canned items also. So, what happens is this lactose is a complex sugar. Now, this complex sugar will be absorbed by our body, by our small intestine. This is the place where the absorption of the nutrients takes place. So this complex sugar is broken down into simple sugar, that is glucose, galactose, which is then absorbed by the small intestine. To break down this complex sugar into simple sugars, the role is the digestive enzyme, that is lactase. Our body is deficient, or when it has decreased lactase enzyme, this lactose cannot be broken down into simple sugars, and that is why it remains unabsorbed or malabsorbed. And that is why we get the symptoms of lactose intolerance, and we term it as lactose intolerant. Now we know what food products contain lactose, and what food products we have when we have lactose intolerance. Those milk and milk products, and whenever we buy some packaged or like canned food items or like frozen food items, we should always look into those food label, because it may say as milk byproducts, milk dry products, or whey protein, milk protein, casein protein. All these items will be there. Apart from this, we know it's yogurt, cheese, curd, buttermilk, butter, ghee, bread, and all such items. They also contain lactose. Now, talking about milk allergy, that is cow milk allergy, what age group will represent this allergy? So now this is common in children during the first year of life. Why do we say during the first year of life? Because the gut, the small intestine, is still immature. In infants, it is still maturing. Also, like up to the age of 5 years, it is mostly common, but predominantly up to the age of 1 year or during the first year of life. Also, we should know that milk allergy will as we grow up. So 80% of allergies are treated. 80% of allergies, cow milk allergies, are subsided. Now, what a kid may show up who is having a cow milk allergy, or what are the symptoms? Now, when we talk about the symptoms, we should it's mainly related to the gut. So, the vomiting, abdominal cramp, bloating, gas, these symptoms will be present in the cow milk allergy when the kid has cow milk allergy. Now, talking about lactose intolerance, what age group will have lactose intolerance? So, speaking of lactose intolerance, it can occur at uh, any age group. So, it can occur during the childhood, it can occur during the adolescent period, it can occur during the adulthood. So, in fact, it is most common during the adulthood, because as we grow up, as we mature, the lactase enzyme decreases in our body, and that is why we develop intolerance to milk and milk products, and that is intolerance. So, as I said, it's more in adulthood, right? So, do kids or do infants have lactose intolerance? So, speaking of infants, that is up to the age of 1 year, do they have lactose intolerance? Yes, there are two conditions, and those are rare conditions in which infants can have lactose intolerance. So, one is when the baby is born premature. The baby can have developmental lactase deficiency. That means the lactase deficiency will eventually the intestine will eventually get mature. So this can subside when the baby grows, when the baby is maturing. So this is a temporary condition, and this can be treated. Now the second condition is congenital lactase deficiency, where see, this condition is a rare condition, this congenital lactase deficiency, and also it is a severe condition, because over here there will be severe diarrhea, dehydration, and growth retardation. Okay, so this was about infants, where we can see two conditions. Now, what about kids? What about children? Now, in children, there can temporary lactose intolerance. Now, what is temporary lactose intolerance? Whenever a kid has some infection, some kind of viral infection, or like a gut infection, stomach infection, then it can be temporary, because as they improve, as the condition improves, the lactose deficiency will also subside. Also, disease that is known as celiac disease, where there is inflammation of the small intestine. So this can occur in kids, but this will improve with time, and so the lactose intolerance will also improve with time. And now, talking about how can you identify if your kid, your infant, or anyone has lactose intolerance. So, lactose intolerance will have the same symptoms like nausea, vomiting, and abdominal cramp, diarrhea. So, talking about the symptoms, we should keep in mind that milk allergy seems to be more severe than the symptoms of the lactose intolerance. Cow's milk allergy is basically an allergic reaction. It is so in that case, you will get some symptoms in minutes of consuming milk or milk products, and those will be like itching. There will be swelling of the lip, face. There will be a wheezing, difficulty in breathing, then tightness of the chest, runny nose, watery eye, all these things, with nausea, vomiting, abdominal cramp, diarrhea. Your diarrhea may be included with blood, and yeah, these things. So the symptoms are more severe in milk allergy as compared to the lactose intolerance. Now, how do we diagnose? whether a patient has milk allergy or lactose intolerance. So first of all, we ask the history, the diet, what the patient is consuming, or what is in the whole day. We just ask about all those things so that we can make a clear cut, like what is going on, whether it's milk allergy or lactose intolerance. Other than that, there is a test that is known as hydrogen breath test. So what happens over here is the child in a container, and the child will be a container where we will measure the hydrogen levels before and after, like drinking a beverage that contains a certain amount of lactose. So like normal people, there is small amount of hydrogen will be detected, okay, during this test. But if there is lactose intolerance, then the hydrogen levels will be in positive test. Other than that, the stool examination can be done. So the stool examination will show acidic stool or low pH, so this is intolerance. Also we will see there will be presence of glucose, that is reducing substance, and this means the glucose by the small intestine. Other than that, uh, if the condition is severe, the pediatric gastroenterologist can also look into, and endoscopy with biopsy will be done here. So the lactose will be directly measured from that. So other than this, now how do we manage such patients, or those who have milk allergy and those who have lactose intolerance? Sorry. So the first thing would be you have to avoid those food products, like those and milk products or dairy products, those contain lactose. We have to give lactose free dairy products, or a dietitian can also help in this. There are supplements that is known as lactase enzyme supplements. So what is given here is a lactase enzyme supplement. What it will do is it will help in breaking down lactose into simple, so that is glucose and galactose, and then it can be easily absorbed by the small intestine. Then there are formulas like milk substitutes. Now if there is lactose intolerance or milk allergy, what substitutes can you give? So there are hypoallergenic formulas. What you mean by this is the protein is hydrolyzed, or the protein is broken down. The protein is pre-digested already, so there will be no problem in absorption. There are soy-based formulas, amino-based formulas. There is oat-based fortified formulas, and such different formulas that are lactose-free, or those have very low content of lactose, so it's easily absorbed by our. Now, like one question arises is if we completely ban milk or milk products, we avoid milk or milk products, and we go with lactose free products, what about calcium, right? We get calcium through milk, so what do? This is what parents ask. So we can go for substitutes other than milk, like we add up green leafy veggies, we add nuts like almonds and beans and fish. That what the we go to the other sources that are calcium. Calcium supplements can also be added after talking to your pediatrician. Now let's talk about breast milk and breastfeeding. How is this related to cow milk allergy or lactose intolerance? Now, if the mother has cow milk allergy, the mother has lactose intolerance, can she feed her baby or not? She can feed her baby, because breast milk is very important for the growth of the baby. As the baby is not having any allergy or intolerance, it is the mother who is having, she can feed her baby, because breast milk is the most nutritious milk for the baby. Now, if baby has cow milk allergy or lactose intolerance, can mother feed breast milk to the baby? So now here the question is, the mother has to avoid all such things, like she has to go for lactose free products, she has to avoid, or she can go for lactose free formulas for the baby, the milk. Now there's also a condition that is called as breast milk allergy. So this condition is very rare. It is a very rare genetic disorder. So you'll be allergic to the breast milk, but this is very rare. Otherwise, no infant, no kid allergic to the breast milk, but baby can be allergic to the content of the breast milk, like something that has eaten and that has made its way to the breast milk. And those products can be dairy or peanuts or soy products. Like these are the common products. Yeah. So the main thing is to avoid milk and milk products or dairy products and go for lactose free products. Now, what parents may ask, like, how do I know the difference between the cow milk allergy or between cow milk allergy or the lactose intolerance? So how do we know about it? As I said, the symptoms will be more severe in cow milk allergy comparatively to the lactose intolerance. Also, what you could do is, if suspicious, what you can do is, for a week or two, you can cut off, you can avoid milk and milk products child's diet. Then you can look for the symptoms. If they are going away, also then you can start reintroducing those food items, milk and milk products, after a gap of 2 weeks. Now if you see that the symptoms are appearing up, they are reintroducing, so then you be suspicious. Okay, there is something wrong with the baby, which may be a milk allergy or lactose intolerance. Now what also parents avoid giving to my kid when my kid is lactose, as I said, all dairy products, milk products that contain whey, casein, and also like curd, ghee, butter, buttermilk, cheese. All these products are to be avoided. Now, can the symptoms of lactose intolerance be controlled? Symptoms can be controlled, and they are not very severe. Also, the symptoms can be controlled if you give lactose free dairy products, or if you give lactose free milk substitutes. Symptoms can be controlled, and also lactose intolerance temporary, in some cases improve with time. Now, sorry. Parents also ask, what are the other alternatives, or what are the other alternative milk that we can give to our kid who has milk allergy. So as I said, there are many substitutes. You get like soy protein based, amino based, oat based, and there are iron fortified also. So all these products can be given if you have any if you have to give any milk substitute to your kid. Yeah, so this is it. I wanted to talk about lactose intolerance and milk allergy. So we have to remember this, that these two terms are entirely different terms, and so are their treatment. So that their treatment is also accordingly different. So we need to keep in mind this thing. If there are any questions, I will answer them. And so now I would like to end this by giving a takeaway message for parents. You should be able to identify your kid, whether the kid is having allergy or not, or whether the kid is or not, by looking onto the symptoms. And as I said, you can just put a gap of 1 to 2 weeks and look into it, and then you can consult your pediatrician who can work up further. And yeah, so if we see the diet, we have to look into that we have to give the diet or lactose free milk and milk products or milk substitutes. Yeah, that's it. So okay, you all can follow me on Baby Chakra and by using my referral code. So we can have informative sessions also again. Yeah, thank you.